Caffeine. Caffeine is a stimulant, a chemical that speeds up your brain and nervous system. It's found in coffee, tea, soda, and energy drinks, powering billions of people every morning. For most people, it isn't just a drink. It's a ritual. The day doesn't begin until that first sip hits. Once you drink it, caffeine enters your bloodstream and quickly travels to your brain. There, it blocks a chemical called adenosine, which normally tells your brain that it's tired. So caffeine doesn't actually give you energy. It hides your exhaustion. Your neurons start firing faster. Your heart beats stronger. Suddenly you feel sharper, more alert, more alive. Within 20 to 30 minutes, the peak kicks in. You're focused, motivated, and confident. The world feels clearer, easier, more controllable. But as your body breaks caffeine down, adenosine floods back in, and you crash. That sharp focus fades into irritability, jitteriness, and the creeping thought that maybe one more coffee will fix it. Caffeine is mildly addictive, but it hides behind routine. Over time, your brain adjusts and produces less natural alertness. You need more caffeine just to feel normal. Quit suddenly, and you'll notice it. Headaches, fatigue, brain fog. We joke about needing coffee to survive, but that's withdrawal disguised as culture. The truth is, caffeine doesn't wake you up. It just delays your tiredness until later. Nicotine. Nicotine is a fast-acting stimulant found in tobacco and vapes. It's the chemical that hooks people, not the smoke itself. Inhaled through smoke or vapor, nicotine reaches the brain within seconds. There, it releases a surge of dopamine, the chemical linked to calm, focus, and pleasure. At first, it feels perfect. Your heart rate rises slightly. Your thoughts feel clear. Stress melts away. This is the onset, a brief, clean high that feels controlled. But nicotine burns out quickly. As dopamine fades, calm turns into tension, restlessness, and craving. That's the trap. Each puff only relieves the discomfort created by the previous one. Nicotine doesn't truly relax you. It just resets withdrawal. Over time, it rewires your brain's dopamine system. Without it, everything feels dull and flat. Physically, it damages your lungs, blood vessels, and heart. Mentally, it convinces you that you can't cope without it. Alcohol. Alcohol is a depressant. It slows down your brain and nervous system. People drink it everywhere. Parties, dinners, celebrations, moments of escape. Once alcohol enters your bloodstream, it disrupts how your brain communicates with itself. At first, it feels good. Warmth, relaxation, confidence. You feel more social, more open. At the peak, judgment fades. Emotions rise, coordination slips. But your brain still thinks everything is fine. That's the illusion. Eventually, the comedown hits. The warmth turns heavy. The buzz turns blurry. Hours later comes dehydration, nausea, brain fog, the hangover. Alcohol is addictive in quiet, familiar ways. Over time, you're not drinking for fun, just to feel normal. It damages the liver, weakens the heart, and erodes self-control. It makes you feel alive while slowly dulling everything that makes you human. Cannabis. Cannabis is a psychoactive drug made from the marijuana plant. It's smoked, vaped, or eaten as an edible. The main active chemical is THC, which interacts with the brain's endocannabinoid system, responsible for mood, memory, and perception. When THC reaches the brain, time seems to slow. Senses sharpen. Everything feels warmer, softer, funnier. At the peak, cannabis can increase creativity and calm, or trigger confusion and paranoia, depending on dose and mindset. As the comedown begins, thoughts slow and tiredness sets in. Cannabis is mildly addictive, mostly psychologically. Frequent use can dull motivation, weaken memory, and increase anxiety. Often called harmless, it still quietly reshapes how the brain rewards relaxation. Cocaine. Cocaine is a powerful stimulant made from coca leaves. It's usually snorted, but can also be smoked or injected. It floods the brain with dopamine, preventing the body from reabsorbing it. The onset is almost instant. Euphoria. energy, confidence. At the peak, you feel unstoppable until dopamine crashes. The come down hits hard. Anxiety, exhaustion, depression, craving. Cocaine is highly addictive. Each hit rewires the brain to want another. Over time, it damages the heart, blood vessels, and brain chemistry, making joy without it feel impossible. MDMA, ecstasy, also known as Molly, is a synthetic stimulant and hallucinogen. It is usually taken as a pill or capsule at parties, raves, or nightclubs. Once inside the body, it floods the brain with serotonin, dopamine, and oxytocin. These chemicals control happiness, reward, and emotional bonding. As the effects begin, a warm sensation spreads through the body. Music sounds deeper and more powerful. Lights appear brighter and more vivid. Touch feels intense and electric. You feel deeply connected to friends. You feel connected to strangers. You feel connected to everything around you. Empathy is pushed to its highest level. At the peak, serotonin levels surge dramatically. The world feels perfect. You dance for hours, you talk non-stop. You feel limitless. But MDMA burns through the brain's serotonin extremely fast. Within a few hours, the come-down begins. Emotion fades away. Emptiness, sadness, and exhaustion take its place. The high disappears as suddenly as it arrived. With frequent use, MDMA damages the neurons that release serotonin. Natural happiness becomes harder to feel. Physically, MDMA can dangerously overheat the body. It can cause severe dehydration. In rare cases, it can lead to organ failure. It's often called the love drug, because it makes you feel connected to everyone. But when the effect ends, you realize that connection was chemical, not real, and the brain is left paying the price. LSD. LSD is a hallucinogen, a mind-bending chemical that completely changes how the brain processes reality. It is usually taken on tiny paper tabs placed on the tongue. The dose is incredibly small, measured in millionths of a gram. Once it takes effect, LSD binds to serotonin receptors in the brain, especially one called 5-HT2A. This receptor plays a major role in perception and mood. That's when the onset begins. Patterns start to move. Colors shift and change. Sounds feel like they glow. It's not that hallucinations suddenly appear. It feels like reality itself starts breathing. At the peak, which can last for hours, time begins to lose meaning. Your sense of self starts to dissolve. The part of your brain that says, "I am me," fades away. You may feel connected to the universe. You may feel euphoric. You may feel terrified. Sometimes, all of it at once. Emotions become physical sensations. Music feels alive. The boundary between thoughts and senses disappears. Everything blends into one continuous wave. Then the come-down begins. Slow, gentle, like returning from orbit. Reality rebuilds itself piece by piece. You may feel calm and reflective, or emotionally drained. Some people describe it as a mental reset. Others say they feel permanently rewired. LSD is not physically addictive, but it is unpredictable. The same dose can feel blissful or terrifying. It depends on your mindset and environment. LSD can also trigger flashbacks or long-lasting anxiety. Even after the trip ends, LSD opens the mind, but it doesn't always close the door cleanly behind it. Ketamine. Ketamine is a dissociative anesthetic. It was originally developed for use in surgery. Today, small medical doses are used to treat depression. Recreationally, it is taken for its out-of-body effects. It is commonly snorted as a powder or injected in liquid form. Once it enters the system, ketamine blocks a brain messenger called glutamate. Glutamate helps the brain process sensory information and maintain awareness of reality. The onset is fast. Within minutes, the world begins to feel distant. Sounds become muffled. Everything feels dreamlike. At the peak, perception fully disconnects. You may feel as if you are floating above your body or watching your life from far away. Users often call this state the K-hole. Time stops making sense. You may see yourself from the outside, or feel completely separated from your body. The experience is not always pleasant. For some, it feels peaceful. For others, it is terrifying. As the come down begins, awareness slowly returns. Vision becomes clearer. Speech reconnects. But the world can still feel foggy. For a short time, ketamine can leave you strangely calm, as if your thoughts are moving underwater. Ketamine is not classically addictive, but tolerance builds quickly. Heavy use can lead to memory problems. It can cause bladder damage and emotional numbness. Ketamine can disconnect you from pain, but it can also disconnect you from meaning. It separates the body from the mind, and sometimes they don't fully reconnect. Opioids. Opioids are powerful painkillers. They come from the opium poppy, or they are made synthetically in laboratories. Medically, they include drugs like morphine and oxycodone. On the street, they appear as heroin or fentanyl. They can be swallowed, smoked, snorted, or injected. All opioids work in the same basic way. They bind to opioid receptors in the brain and body. These receptors block pain and flood the system with euphoria. The onset brings warmth, comfort, relief, a deep, heavy calm. It feels like safety itself. Pain fades away, stress disappears, the body relaxes and melts. This is not an energetic high. It feels like sinking into the softest blanket imaginable. At the peak, everything slows down. Breathing becomes shallow. Heart rate drops. Thoughts begin to drift. It feels blissful, but it is dangerously close to unconsciousness. Many users chase that feeling, but each time it becomes shorter, weaker, harder to reach. Then the come down arrives, and it is brutal. Anxiety sets in, muscle pain follows, nausea, sweating, insomnia. Every nerve in the body demands the drug again. This is withdrawal. It doesn't just create craving, it makes life feel unbearable without it. Opioids are among the most addictive substances known. They rewire the brain's survival system, teaching it that the drug is as essential as air. Over time, tolerance collapses. Organs are damaged, relationships are destroyed, lives unravel. The warmth opioids give at the beginning is the same warmth they slowly take away from everything else. Methamphetamine. Methamphetamine is a powerful stimulant. It floods the brain with dopamine and adrenaline. Everything is supercharged at once. It is commonly taken by smoking, swallowing, snorting, or injection. Within seconds, it hits like a lightning strike. As the onset begins, energy erupts. The heart races. The mind sharpens. Every sense is pushed to maximum intensity. You feel awake, unstoppable, invincible. Speech becomes rapid. Thoughts move faster than words. Sleep feels unnecessary. At the peak, the rush is pure intensity. Confidence turns into euphoria. Motivation transforms into obsession. You may clean nonstop, talk for hours, or chase a goal that suddenly feels like destiny. It feels like control. But the brain is burning through its entire dopamine supply at once. Then the come down hits, and it is harsh. Energy disappears. The mind crashes into exhaustion. Depression sets in. Paranoia follows. The world feels slow, gray, empty, a chemical hangover that can last for days. Meth is extremely addictive. Each high rewires the brain to crave that rush again, while destroying the system that creates pleasure naturally. Over time, meth leads to severe weight loss, chronic insomnia, hallucinations, memory loss. Meth gives energy that feels infinite, until you realize it was borrowed from your future self. Psilocybin, better known as magic mushrooms. Psilocybin is a hallucinogen found in certain types of fungi. It can be eaten raw, brewed into a tea, or ground into capsules. Once consumed, the body converts psilocybin into psilocin. Psilocin interacts with serotonin receptors in the brain. The onset begins within about 30 minutes. Senses become sharper. Patterns begin to shimmer. Reality starts to ripple. Laughter comes easily. Music feels alive. You become aware of everything at once. Your body, your breath, the air around you. At the peak, perception transforms completely. Colors pulse. Time stretches. You may feel a deep connection to nature, to memories, to emotion itself. Some describe the experience as enlightenment. Others describe it as chaos. It can feel like the mind dissolves into something larger, beautiful, or overwhelming, depending on what you bring into the experience. As the come-down arrives, thoughts begin to settle. The world slowly rebuilds itself. You may feel peaceful, grateful, emotionally open. But for some people, confusion remains, or anxiety that lingers for days. Psilocybin is not physically addictive, but it is powerful. In the right setting, it can help break old mental patterns. In the wrong setting, it can trigger panic or psychosis. Mushrooms don't show you something new. They simply pull back the curtain on what was already inside your mind. Benzodiazepines are sedative medications. They are prescribed to treat anxiety, panic attacks, and insomnia. They are usually taken as pills. They work by increasing the effect of GABA. GABA is a brain chemical that slows activity and creates a sense of calm. After taking one, the onset feels like relief. Muscles loosen, thoughts become quiet. The world feels less sharp. Heart rate slows, the body relaxes. Stress drifts away like fog. At the peak, everything feels soft and slightly distant. Worry fades, time drifts, sleep comes easily. As the come-down begins, the calm starts to change. Drowsiness turns into confusion. Memory begins to slip. Emotions feel flattened. With frequent use, the brain forgets how to stay calm on its own. Benzodiazepines are highly addictive, especially when used beyond a prescription. Over time, tolerance builds quickly. You need more to feel the same calm. Stopping suddenly can be dangerous. It can cause intense anxiety, tremors, or even seizures. Withdrawal often requires medical supervision. Benzodiazepines quiet the mind, but silence can become addictive. The real danger isn't the calm they bring, it's how easily they convince you that you can't live without it.